10 warning signs your body needs help immediately. Hello and welcome. It is wonderful to have you with us this morning. Our bodies have a remarkable way of communicating with us, sending us little signals when something isn't quite right. As we get older, it becomes even more important to listen to these signals. Sometimes they are just minor whispers, but other times they are loud alarms telling us that we need to pay immediate attention. Ignoring these warnings can sometimes lead to more serious health problems down the road. It is always better to be safe and to understand what our bodies might be trying to tell us. Before we begin, I have a simple question for you. Have you taken a moment this morning to simply notice how you are feeling? Let me know in the comments below how you are feeling today. It is a good habit to check in with yourself each day. Now, let's talk about 10 important warning signs that your body might be sending you, and why it is so crucial to listen to them. First on our list is something that can be very easy to dismiss, and that is unusual and persistent fatigue. Now, we all feel tired from time to time. A poor night's sleep, a busy day with the grandchildren, or a stressful week can certainly leave us feeling drained. That is a normal part of life. The kind of fatigue we are talking about here is different. It is a deep, profound tiredness that doesn't go away, even with plenty of rest. It is a feeling of being completely wiped out day after day for weeks on end. This is not the kind of tiredness that a good cup of coffee can fix. It is a constant state of exhaustion that interferes with your daily activities. You might find that you are too tired to do the things you once enjoyed, like gardening, going for a walk, or visiting with friends. Even simple tasks like grocery shopping or cleaning the house can feel like climbing a mountain. This persistent fatigue can be a sign of many different underlying health issues. One of the most common is anemia, which is when you do not have enough healthy red blood cells to carry adequate oxygen to your body's tissues. This can leave you feeling tired and weak. Another possibility is an underactive thyroid, a condition called hypothyroidism. Your thyroid gland produces hormones that regulate your metabolism, and when it is not working properly, it can cause a wide range of symptoms, including severe fatigue. It is also important to consider that ongoing, unexplained exhaustion can sometimes be a sign of more serious conditions such as heart disease. When your heart is not pumping efficiently, your body does not get the oxygen-rich blood it needs, which can lead to fatigue. Certain cancers can also cause a deep and persistent tiredness. It is the body's way of telling you that it is working overtime to fight off something serious. Mental health conditions like depression can also manifest as physical symptoms, and profound fatigue is a very common one. So if you are feeling a level of tiredness that is not normal for you and it has been going on for a while, please do not just brush it off as a normal part of getting older. It is a very real signal from your body that something is not right, and it is worth talking to a healthcare professional about. The second warning sign we are going to discuss is unexplained weight loss. For many people, losing a little weight might seem like a good thing, but if you are losing weight without trying, without changing your diet, or increasing your physical activity, it can be a cause for concern. We are not talking about losing a pound or two here and there. We are talking about a noticeable and unintentional loss of weight, say more than 5% of your body weight over a period of 6 to 12 months. For example, if you weigh 150 pounds, a 5% weight loss would be 7.5 pounds. If you have lost that amount of weight or more without a clear reason, your body is sending you a strong message. Unexplained weight loss can be a symptom of a wide range of medical conditions. One of the first things a doctor might consider is an overactive thyroid, or hyperthyroidism. This is when your thyroid gland produces too much of the hormone thyroxine, which can cause your metabolism to speed up, leading to weight loss. Another common cause is diabetes. In people with undiagnosed diabetes, the body is not able to use glucose for energy properly, so it starts burning fat and muscle for fuel, resulting in weight loss. Digestive issues can also be to blame. Conditions like celiac disease, which is an intolerance to gluten, or Crohn's disease, can interfere with your body's ability to absorb nutrients from food, leading to weight loss. It is also important to be aware that unexplained weight loss can be one of the first signs of cancer. Cancer cells use up a lot of the body's energy, which can lead to weight loss. Cancers of the pancreas, stomach, esophagus, or lung are often associated with this symptom. So if you notice that your clothes are getting looser and the number on the scale is going down without any effort on your part, please take it seriously. It is a significant warning sign that should be investigated by a doctor. Let's move on to our third warning sign, which is persistent pain. Aches and pains can be a common part of aging. We might wake up with a stiff back or have a knee that bothers us on a rainy day. But we are not talking about these everyday minor aches. We are talking about pain that is persistent, that does not go away, or that is severe. Pain is your body's alarm system. It is telling you that something is wrong. For example, a persistent headache that is different from any headache you have had before could be a sign of a serious issue, like a brain tumor or an aneurysm. It is especially important to pay attention to a headache that is sudden and severe, often described as the worst headache of your life, as this can be a symptom of a stroke. Persistent pain in other parts of your body should also not be ignored. For example, ongoing chest pain could be a sign of heart disease. It might not always be a sharp, crushing pain. Sometimes it can feel more like pressure, squeezing, or fullness in the chest. This pain might also spread to your arms, back, neck, jaw, or stomach. Abdominal pain that is severe or that lasts for several days could indicate a problem with one of your internal organs, such as your gallbladder, pancreas, or intestines. Persistent pain in your bones could be a sign of cancer that has spread, or it could be a symptom of a vitamin D deficiency, which can lead to a condition called osteomalacia, where your bones become soft. The key here is the word persistent. If you have a pain that is not getting better with time and simple home remedies, it is your body's way of telling you that you need to seek medical help to find out what is causing it. Our fourth warning sign is a noticeable change in your bowel or bladder habits. This is a topic that some people might feel embarrassed to talk about, but it is very important. Your bathroom habits can tell you a lot about your overall health. If you notice any significant and lasting changes, you should pay attention. For example, if you have been very regular your whole life and you suddenly experience persistent constipation or diarrhea that lasts for more than a few days, it could be a sign of an underlying issue. These changes could be caused by something as simple as a change in your diet or a new medication. However, they can also be symptoms of more serious conditions like irritable bowel syndrome, an inflammatory bowel disease like Crohn's disease or ulcerative colitis, or even colorectal cancer. Another important change to watch for is the presence of blood in your stool or urine. If you see bright red blood in the toilet bowl or on the toilet paper after a bowel movement, it could be due to hemorrhoids or a small tear, but it could also be a sign of something more serious, like colon cancer. Similarly, blood in your urine, which might make it look pink, red, or the color of cola, should never be ignored. It can be a sign of a urinary tract infection, kidney stones, or bladder or kidney cancer. Changes in urination, such as having to go more frequently, having a weak stream, or feeling like you cannot empty your bladder completely, can also be warning signs, especially for men, as they can be symptoms of an enlarged prostate or prostate cancer. For women, these symptoms could indicate a bladder infection or other pelvic issues. The bottom line is that any significant and lasting change in your bowel or bladder habits is worth discussing with a healthcare professional. Now for our fifth warning sign, a sore that does not heal. When we get a small cut or a scrape, our bodies have a remarkable ability to heal themselves. You might see a scab form, and then over a week or two, new skin grows and the wound closes up. But what if you have a sore that just does not seem to get better? A sore that lingers for weeks or even months is a clear signal that something is wrong. This could be a sore on your skin, in your mouth, or anywhere else on your body. A non-healing sore on your skin can be a sign of skin cancer. There are different types of skin cancer, and they can look different. For example, a basal cell carcinoma might look like a small, pearly bump, or a flat, flesh-colored or brown, scar-like lesion. A squamous cell carcinoma might appear as a firm red nodule or a flat lesion with a scaly, crusted surface. Melanoma, the most serious type of skin cancer, often appears as a large brownish spot with darker speckles or a mole that changes in color, size, or feel, or that bleeds. It is a good idea to check your skin regularly for any new or changing spots. A simple way to remember what to look for is the ABCDE rule for moles. Asymmetry. One half of the mole does not match the other. Border. The edges are irregular, ragged, notched, or blurred. Color. The color is not the same all over and may include different shades of brown or black, or sometimes with patches of pink, red, white, or blue. Diameter. The spot is larger than 6 millimeters across, which is about the size of a pencil eraser. And evolving, the mole is changing in size, shape, or color. A sore in your mouth that does not heal can also be a sign of oral cancer. This is especially true if you are a smoker or you drink a lot of alcohol. If you have a sore in your mouth that has been there for more than 2 weeks, it is important to have it checked out by a dentist or a doctor. Sores that do not heal can also be a sign of other underlying health problems. For example, people with diabetes sometimes have poor circulation and nerve damage, which can make it difficult for wounds, especially on the feet, to heal. This can lead to serious infections. So, if you have a sore that is not healing, no matter where it is on your body, it is a clear warning sign that you need to see a healthcare professional. The sixth warning sign we are going to talk about is difficulty swallowing. From time to time, we might feel like a piece of food gets stuck in our throat for a moment, and a sip of water usually solves the problem. But we are talking about a persistent difficulty with swallowing, a feeling that food is getting stuck in your throat or chest, or even pain when you swallow. This condition is known as dysphagia, and it is not something to be taken lightly. You might find yourself coughing or choking when you eat or drink. You might also have the sensation of food or stomach acid backing up into your throat. Difficulty swallowing can have many different causes. Sometimes it can be due to a problem with the muscles and nerves that control swallowing. This can happen as a result of a stroke or a neurological condition like Parkinson's disease or multiple sclerosis. Another possible cause is a narrowing of the esophagus, which is the tube that carries food from your throat to your stomach. This narrowing can be caused by scar tissue from acid reflux, or it could be due to a more serious condition like esophageal cancer. Gastroesophageal reflux disease, or GERD, is a common condition where stomach acid frequently flows back into the esophagus. Over time, this can damage the lining of the esophagus and lead to difficulty swallowing. In some cases, difficulty swallowing can be a sign of cancer of the throat or esophagus. This is why it is so important to have this symptom evaluated by a doctor. If you are consistently having trouble swallowing, do not just switch to a diet of soft foods and ignore the problem. It is a warning sign that needs to be investigated. Let's move on to our seventh warning sign, which is a nagging cough or hoarseness. A cough is a common symptom of a cold or the flu, and it usually goes away on its own within a few weeks. But a cough that lingers for a long time, say more than 3 or 4 weeks, is considered a chronic cough, and it could be a sign of an underlying health problem. Similarly, a change in your voice, such as persistent hoarseness that lasts for more than a couple of weeks, should also be taken seriously. A chronic cough can have many causes. It could be a symptom of asthma, especially a type of asthma where the main symptom is a cough. It could also be due to allergies or postnasal drip, where mucus drips down the back of your throat. Acid reflux, or GERD, can also cause a chronic cough, as the stomach acid can irritate the throat. In some cases, a persistent cough can be a side effect of a medication, such as certain blood pressure drugs. However, a nagging cough can also be a sign of a more serious condition, such as chronic obstructive pulmonary disease, or COPD, which is a group of lung diseases that block airflow and make it difficult to breathe. It can also be a symptom of lung cancer, especially if the cough is accompanied by other symptoms like chest pain, shortness of breath, or coughing up blood. Persistent hoarseness can also have various causes. It might be due to a simple case of laryngitis, but if it does not go away, it could be a sign of a more serious problem, like polyps on the vocal cords or even cancer of the larynx, also known as the voice box. So if you have a cough or a hoarse voice that just will not go away, it is important to see a doctor to find out the cause. Our eighth warning sign is a change in a mole or a new skin lesion. We touched on this briefly when we talked about sores that do not heal, but it is so important that it deserves its own discussion. Skin cancer is the most common type of cancer, and it is often curable if it is caught early. That is why it is so important to be familiar with your own skin and to pay attention to any changes. You should check your skin regularly, perhaps once a month, for any new moles or other growths, or any changes in existing moles. A good way to do this is to stand in front of a full-length mirror and use a hand mirror to check your back and other hard-to-see areas. As we mentioned earlier, the ABCDEs of melanoma are a helpful guide. Let's go over them again. A is for asymmetry. If you draw a line through the middle of the mole, the two halves do not match. B is for border. The edges are uneven, scalloped, or notched. C is for color. The mole has a variety of colors, such as different shades of brown, tan, or black. It might also have areas of red, white, or blue. D is for diameter. The mole is larger than a pencil eraser, which is about 6 millimeters. E is for evolving. The mole has changed in size, shape, color, or elevation, or you notice new symptoms like bleeding, itching, or crusting. Not all skin cancers follow these rules, so it is important to see a doctor if you notice any new or changing spot on your skin. It is much better to have it checked out and find out that it is nothing to worry about than to ignore it and risk a more serious problem later on. Now, for our 9th warning sign, shortness of breath. Feeling out of breath after climbing a steep hill or running to catch a bus is normal. But if you find yourself getting short of breath during activities that you used to do with ease, or if you feel breathless even when you are resting, it is a sign that your body is not getting enough oxygen. This is a serious symptom that should never be ignored. Shortness of breath can be a sign of a problem with your lungs or your heart. Lung conditions that can cause shortness of breath include asthma, chronic obstructive pulmonary disease, COPD, and pneumonia. It can also be a symptom of a pulmonary embolism, which is a blood clot in the lungs. This is a medical emergency that requires immediate attention. Heart conditions are another major cause of shortness of breath. If your heart is not pumping blood effectively, fluid can back up into your lungs, making it difficult to breathe. This can be a sign of heart failure. A heart attack can also cause shortness of breath, sometimes with or without chest pain. Anemia, which we mentioned earlier as a cause of fatigue, can also cause you to feel short of breath because your body is not getting enough oxygen-rich blood. Anxiety and panic attacks can also cause shortness of breath, but it is important to rule out any physical causes first. If you are experiencing unexplained shortness of breath, especially if it comes on suddenly or is severe, you should seek medical help right away. Finally, our 10th warning sign is confusion or a change in personality. It is normal to have moments of forgetfulness as we get older. We might misplace our keys or forget a name from time to time, but we are not talking about these minor memory lapses. We are talking about more significant changes in your thinking, memory, or personality. For example, you might have trouble with tasks that used to be easy, like managing your finances or following a familiar recipe. You might get lost in a familiar place. You might find it difficult to follow a conversation or find the right words to express yourself. You might also notice changes in your mood or personality. For example, you might become more irritable, anxious, or withdrawn. These changes can be very distressing, both for the person experiencing them and for their loved ones. It is important to know that these are not a normal part of aging. They can be a sign of an underlying medical condition. One possibility is a urinary tract infection. In older adults, a UTI can sometimes cause confusion and delirium. Another potential cause is a nutritional deficiency, such as a lack of vitamin B12. Vitamin B12 is important for brain function, and a deficiency can lead to confusion and memory problems. For example, to get the recommended daily amount of vitamin B12, which is about 2.4 micrograms, you would need to eat about 3 ounces of cooked salmon or about 4 large eggs. If your diet is lacking in these types of foods, you could be at risk for a deficiency. Of course, these symptoms can also be early signs of dementia, such as Alzheimer's disease. While there is no cure for Alzheimer's disease, an early diagnosis is important because it can allow you to access treatments that can help manage the symptoms and plan for the future. Other conditions, such as a stroke or a brain tumor, can also cause changes in thinking and personality. The important thing to remember is that if you or a loved one is experiencing these types of changes, it is crucial to see a doctor. There may be a treatable underlying cause, and even if it is something more serious, getting a diagnosis is the first step toward getting the help and support you need. So, there you have it, 10 important warning signs that your body might be sending you. It is so important to be in tune with your body and to not dismiss these signals. Your body is incredibly intelligent, and it will let you know when it needs help. I hope this information has been helpful to you. Thank you for joining me today. I encourage you to subscribe to this channel for more helpful information to support your health and well-being. Please remember, I am not a medical doctor. The information shared in this video is based on extensive research and experience in helping people with their diets and overall wellness. It is for educational purposes only and should not be taken as medical advice. Always consult with your own healthcare provider for any health concerns you may